Hi, my name is Suresh. My dad had a very bad fall in the bathroom, so immediately we rushed him to the Manipal Sarjapur Hospital. So immediately emergency doctors treated him and they told us that he has to undergo a major surgery, but we were a little skeptical. His neck bone was dislocated and it was a major surgery which was performed by Dr. Ajay Hegde.
Hello, I'm Dr. Ajay Hegde, consultant neurosurgeon at Manipal Hospital Sarjapur Road. Mr. Rama Reddy is an 82-year-old man who came to us after a history of a fall. He had fractures of multiple spinal bones, the most significant being at the C1, C2 junction, which is normally called the atlantoaxial joint. So he had a C2 fracture with atlantoaxial dislocation with severe spinal cord compression.
Hi, I am Dr. Narayana Swamy. I am the consultant ICU at Manipal Hospital Sarjapur Road. I was part of the team involved in taking care of a patient, Mr. Rama Reddy. He is an elderly man, multiple comorbid conditions. He was admitted with fracture of the high cervical spine, causing a compression over the spinal cord. When he came to the ER, all of us, we have seen him, he is having a multiple cervical spine injuries compressing over the spinal cord.
Hi, I'm Dr. Niharika. I head the Department of Emergency Medicine in Manipal Hospital Sarjapur. Today we are here to talk about a patient who came to ED on 28th of December with a history of fall in his washroom. He was brought by his attenders who did not notice the fall but saw him afterwards, and he seemed confused and restless to them. On presentation, the patient was restless. We did a primary survey and a secondary survey as per our trauma protocol. Even if he was not complaining of neck pain, we must stabilize his neck, and thereafter we took care of other parts of the injuries.
He underwent a very complex surgical procedure at the C1, C2 joint, which involved reducing the fractured segments and fixing it with screws and rods.
The patient was admitted in ICU. The ICU care was taken up by Dr. Narayana Swamy and his team, and the patient recovered wonderfully. So it was very good to see him walking on his two limbs back again, and that was a fantastic recovery from the fracture after the surgical treatment.
Usually these sort of patients, if the age is not on their side, usually they may not survive and not make it up to the hospital in the first case. We managed him conservatively with the help of high nasal flow oxygen and all those such facilities. Thanks for Manipal Hospital Sarjapur for providing all the supports, equipment and all. We could able to successfully come out of surgery. Today he is walking, no neurological deficits and all. We are fortunate to be part of this management of this patient. Thank you.
The surgery was successful, and again our ICU team helped him recover to what he is today. The family members, especially his children, were very supportive in facilitating the surgery, and they understood the complexity of the surgical procedure and provided him the much needed support system which is required during the recovery phase.
So now it is far much better. He's able to walk. He's very active now, and I'm very thankful for the Dr. Ajay Hegde and his team. And overall experience really good. And from the day, from the admission point of till the discharge, the process was really very smooth, and we had a very great experience with the Manipal Sarjapur Hospital.